Call it COVID fatigue, COVID exhaustion, or just being plain over it. Feelings we're all probably guilty of, but really we can't let our guard down.
That lesson learned the hard way by one Bend man. He describes himself as healthy, active, with no underlying health conditions.
Despite his clean bill of health, his COVID-19 diagnosis landed him in the hospital twice.
Tonight, he shares his story in hopes of inspiring us all to keep protecting each other.
He's a father, dentist, hunter, and now a COVID survivor. Philippe Freeman, who goes by Flip, is sharing his story from a distance.
Sorry to keep you a prisoner in your own house, but talking about how easily it spreads, I feel like this is the safest option.
That's okay. I want to keep you both safe. So.
3 weeks ago, Flip was exposed.
Unfortunately, it was infected by a friend. The person that exposed me wasn't willing to tell me that they had tested positive, so I was unknowingly exposing other people.
Typically, you'd find Flip here during the week as a dentist at Deschutes Dental. Luckily, the week after his exposure, he was on a hunting trip with a couple of friends. That week ended with some hints at his illness.
Very sore muscles, very tired, and felt kind of a tightness in my chest. I finally put a few things together and realized I should get tested. I got tested and tested positive, and then it went downhill very fast from there.
Roughly 8 days after his exposure, the symptoms set in.
I couldn't move. I literally had no will to move.
His body was starving for oxygen, and his wife took action, bringing him to St. Charles.
First 2 days, lots of oxygen, lots of medicine and cocktails and remdesivir. I think I was in shock. I didn't realize someone like me would get it to that level.
Someone like him, a man in his 50s dedicated to his health.
I have zero health issues. I've never been hospitalized. I don't take medications. We exercise regular. We have an athletic lifestyle.
Despite Flip's clean bill of health, SARS-CoV-2 beat him down. He was discharged from the hospital after 3 days, just to return a few days later for completely different symptoms.
My arm started tingling a few times, and then Sunday morning my whole arm went numb, and I had compressive pressure in my heart, not my chest. I could feel it in my heart.
More tests, more injections, more monitoring.
I did lose 14 pounds in this last 2 weeks.
Finally, Flip is home and recovering.
I'm on day 17, and this is actually the best day I've had.
The days are getting easier, but the lesson is still a scary one.
I think the majority of people are probably going to get it less than I did, but the thing is you don't get to choose that. And then you don't get to choose who you give it to.
What you do get to choose is how you protect others. Flip spent roughly 2 days in his dental office before testing positive.
You know, I work 15 inches from people's face. We tested all our patients after a week and all our staff, and nobody contracted it from me, so I'm here to tell you that the PPE works.
His message is clear. The protocols worked, protecting those in his office. But everyone he came in contact with, without a mask on, contracted the disease.
It's not a stigma. I'm happy to share this story because I don't want people to hide it from other people and then allow other people to continue to pass it on to somebody else that it could have a much more grave effect on.
Flip continues healing at home, but not everyone is as lucky.
I'm sure my experience won't change other people's perspective, but if you get it like I got, it'll change your perspective.
A perspective that could save a life.